Autism Awareness within Latino and African American communities. What is autism? Autism spectrum disorder, or ASD, and autism are common terms for a group of complex disorders of brain development. These disorders are characterized in varying degrees by difficulties in social interaction, verbal and nonverbal communication, and repetitive patterns of behavior, interests, or activities. What does the research tell us? Studies show that 1 in 68 American children are on the autism spectrum. Autism is more common in boys than in girls. There are currently over 3 million documented cases of autism in the United States, and there is a low rate of early diagnosis and treatment along with a misdiagnosis of Latino and African American children. The last point is the one I am focusing on. There is a cultural and socioeconomical divide. Minority children are diagnosed with autism later than other children. Autism is rising, but children of color are not being accurately accounted for. Early intervention is key to a better outcome for children with autism, along with resources and services such as speech and behavioral therapy. There are multiple reasons for not seeking help earlier, such as access to health care, access to resources, cultural issues and beliefs, as well as a complete misunderstanding of what autism actually is. This disparity in valuable services, early intervention, and a misunderstanding of autism spectrum disorders within the Latino and African American communities is what we are looking to address. The driving force behind my project is my 2 nephews, Ricardo and Angel. They both have autism. I was also inspired by organizations that are already advocating for autism awareness, such as Autism Speaks and the Autism Society of America. They're shedding the light on autism spectrum disorders and educating the public by raising awareness and raising money for autism research. However, their focus is on a much larger and national scale. For my project, I decided to develop a nonprofit autism awareness advocacy group that will educate and provide access to valuable resources and services to families of the Latino and African American communities. For the first 2 years, our initial focus will be in Prince George's and Montgomery County, Maryland. I also developed a logo for our advocacy group that clearly defines what we do. The name of our group is SOAR, an acronym for Strengthening Opportunities for Autistic Resources. We use the universal puzzle piece that is used to symbolize autism. We want our children to soar, to reach new heights, to succeed, to rise above autism and the misconceptions of their disorder. I also created a business card. The business card clearly states what we do, as well as our motto, which is Rising Above Autism. All of our contact information is provided. Another piece that our advocacy group would do is provide informational brochures. Within these brochures, it contains what autism is, the early signs of autism, resources for how to get screening and testing, and an intro to our advocacy group and the services we provide. This brochure is also available in Spanish to reach a larger audience and bridge the language barrier. One of our first events would be a free community fair to provide a safe environment for children and families to connect, share stories, find support, and gain valuable information and resources. We would also be partnering with local schools, churches, and community centers, as well as seeking partnerships and donations from larger groups that are interested in making a difference in our children's lives. During our fair, we would also provide referrals to different healthcare professionals that could provide behavioral therapy, speech therapy, and screening. We would also advertise our translation services that we offer. This community fair would be held in April, which is National Autism Awareness Month. What does the future hold for our advocacy group? In years 1 and 2, our focus would be in Prince George's and Montgomery County, Maryland. We would be holding fairs at each one of these locations. We would be providing translation services and informational brochures in both English and Spanish. We would also visit community schools, community centers, as well as health centers to provide the information within our informational brochures. By measuring the attendance to our community fairs, interest in our group services, and the use of the services provided, we hope to spread to surrounding counties within the Washington metropolitan area. We are striving to obtain enough donations to provide free screenings and additional partnerships to provide a larger network of available resources. Our children deserve to live happy and productive lives. Children with autism deserve to be understood and not be limited to the resources and treatments available to them because of their ethnicity. Let's all stand together, united as a community, and fight for our children's rights. Rising above autism, breaking barriers, providing access, building awareness.